Hi, this is Just Be Well, the channel about whole life wellness. I'm Dr. Tom Sult, a medical doctor and functional medicine practitioner.
I'm Elizabeth, a registered nurse and whole life coach.
And today we are talking about, serious medicine for serious medical problems. We have focused a lot on wellness because really the idea is to raise wellness to the point that disease can't flourish. But I think people have been confused by that maybe functional medicine is some floofy, easy thing, but or just for wellness or just for people who are going to the gym and want to get that next level. And in fact, we see the sickest of the sick. Now, I'm not talking about ICU sick. I'm talking about the walking wounded. I'm talking about people who have chronic complex disease. So, if you need an ICU, you should be in ICU. You shouldn't be probably doing functional medicine. But chronic complex disease, what does that mean? It's people who live with their disease in, day out. So it's autoimmune disease, whether it's arthritis or inflammatory bowel disease or scleroderma or other chronic complex diseases, diabetes, especially type 2 diabetes.
Or maybe it's something that no one has found an answer for you. Perhaps you have a collection of symptoms and have gone from medical doctor to medical doctor, and you have no real clear diagnosis of what's going on.
Right, and that is particularly the case where functional medicine can be very powerful. So maybe you have fibromyalgia, which really doesn't have a great treatment plan, or you have chronic fatigue syndrome, or you have either post-Lyme syndrome or chronic Lyme disease, or something like that. And really what functional medicine is doing is fitting the treatment to you as an individual, not to your disease. In conventional medicine, what normally happens is they say, oh, well, you have arthritis, and then they drill down a little more and they say, oh, well, you have rheumatoid arthritis. And now that we know you have rheumatoid arthritis, here is the basically one-size-fits-all plan. And in functional medicine, we get to that same drilled down diagnosis. Oh, you have rheumatoid arthritis. And then we say, okay, well, why on earth would you be the one with this rheumatoid arthritis? And then you drill down not more into the disease, because we've got the disease figured out. We drill down into you as an individual.
Yep, and your past medical history and maybe things that could have led up to you having rheumatoid arthritis.
Right, so we build this timeline, right? We build this timeline, and the timeline says, well, crack, right? And your wellness cracks like this. And we look right there. What happened right there? And for most people, they were well and it broke a little bit, and then they were well for a while and it broke a little bit, and then they were well for a while and it broke a little bit. And each one of those little breaks is a clue, right? And then we also look, at your what we call antecedents. So we're looking at not only those places where you broke, those are probable places where we're going to find antecedents, which are pre-existing factors, but also your family history. You've got arthritis, and your mother had arthritis, and your father had irritable bowel disease, and your uncle had depression, and your other uncle had heart disease. Well, those are all inflammatory problems. So you have a predisposition to inflammatory issues. So now we start investigating that with labs. So we're looking at your nutritional efficiency. We look at how well you metabolize vitamins and minerals and amino acids and fatty acids and antioxidants, and your toxic load and your genetic predispositions, looking at your genes. But your genes are not your destiny. So how are your genes being washed over by your current lifestyle? And how can we modify that lifestyle and shore up your nutrition and your other lifestyle elements to make your genes express the very best version of you? When you change your diet, when you change your supplements, when you change your toxic load, you change the genes your body is expressing. An example, If you're vitamin D deficient, you're going to upregulate over 200 inflammatory genes and downregulate over 200 anti-inflammatory genes. If you take vitamin D, the opposite is true. You're going to upregulate anti-inflammatory genes and downregulate inflammatory genes. And last time I did that, I did it backwards, I think. How did I do this time?
Yeah, you did it right this time.
So anyway, the point is take vitamin D. And it takes a lot of vitamin D, just on vitamin D. So, the RDA for vitamin D is, I don't know what, a few hundred units or 1,000 units. I don't even know what it is, frankly, because it's so low. I don't even. Is that what it is? 400. And yet, most of my patients, when I actually measure their vitamin D, even though they're on a good diet already, I mean, I see patients, they're already taking multivitamin, they're already on a really good diet, they're already doing yoga, they're trying, they're working their tail off to get better, and they still feel crappy, right? They've been seen by their doctor, they've been seen by the local specialist, they've been seen at the Mayo Clinic, they've been seen at the Cleveland Clinic. I'm not dissing the functional medicine program at the Cleveland Clinic before they had their program. And they've been seen by their chiropractor, they've been seen by a chiropractic specialist, they've been seen by a naturopath, they've been seen by a couple of other holistic providers, and then they find their way in our office, because what we do is tertiary care, or maybe even quaternary care, functional medicine. We see the last. We are the boneyard, as they call it in when you're a resident and you're on the super subspecialty service, you're in the boneyard. It's where the sickest of the sick show up, right? And so here we are with these really unwell people who've done everything, been everywhere, done everything, and we measure their vitamin D, and it's low, like really low, like almost undetectable, or maybe it's 8 or 10 or 12, and they need like 5,000 units every single day just to bring their vitamin D up to a reasonable level, and maybe even more in certain cases if we're really trying to fight inflammation. So we're looking at functional tests, not just their vitamin D level. We look at something, as an example, methylmalonic acid. Methylmalonic acid is a test that tells us how well you are metabolizing B12. Regardless of your B12 level, if your methylmalonic acid is low, you are not using your B12 well, and you either need a different form of B12 or you need more B12. And the same can be said for something called of course, now it just went poof, gone, but there's other tests for almost every single vitamin, a functional test of that vitamin to see how your biochemistry is unique. So, in functional medicine, people always say, well, how would you treat arthritis? Would you use this supplement or that supplement? Well, I don't treat arthritis. I treat the person's unique relationship to their disease and their environment. Right? So yes, you have arthritis, and you should do some certain basic things for arthritis, which may even include medicines from your rheumatologist. But that's the little Dutch boy and his finger in the dike, right? And now we got to repair the dike. So the medication, whether it's just aspirin or it's a biologic, that's just medicine. That's just a finger in the dike. Functional medicine is fixing the dike. Repairing the dike so that the dike isn't leaking anymore.
Yeah. So first you start with, different questions, not what disease do you have, but why do you have this? And then it goes on to doing the different labs to find different inefficiencies that you might have. So how are you, you might be have a normal magnesium level, but maybe you're not utilizing the magnesium you take in. So there's different labs that you do to that tell you different answers. Maybe your fatty acid profile is off, and that's also pushing you into the pro-inflammatory state.
Right, absolutely.
Yeah.
So, and many times we don't even have to do tests. Many times we do the questions. It's so obvious that we just start. And then, of course, because life is the way it is, I think I'm so smart, and I start you on a program. Now the question is better, worse, or the same? Okay, if you're better, fantastic. I'm a genius. If you're worse, okay, well, you don't feel so much like I'm a genius, but that's really valuable information for me. It tells me something about how your physiology responded to that intervention that I thought should have helped you, right? It's super valuable if you're worse. It's not one size fits all. It's not first time done. It's ping You know, like in, what is that, Red October, you know, Sean Connery, is that his name? He's looking through the periscope and he says, verify the distance, 1 ping only. That's my Sean Connery. Anyway, and everybody's astonished. But we're going to ping you with that intervention. And it makes you better. Oh, we're on the right track. If it makes you worse, we have some work to do, but it's valuable information. It tells me something about how you responded. And if you're neither better nor worse, well, maybe we haven't given it enough time, or maybe we just missed the mark and we gotta, again, ping you again and look. And then that's when we think, okay, probably because you didn't respond the way we expected, we're going to do a lab intervention. We're going to figure out what's going on, what's unique and different about you that we need to look at. Maybe you have what's called a SNP, a single nucleotide polymorphism, or in some gene that makes you behave a little differently than other people.
Yeah, and then it comes down to patience too.
Yeah.
So as we start this process, usually when you are, you know, you have, you know, rheumatoid arthritis or irritable bowel syndrome, you know, it's not like, well, typically it's not like you develop this overnight to where you're at. You slowly dwindle down. So it is a process. You explain to patients it's more like a marathon.
Yep.
You know, it's a process of becoming and getting better, because you really have to come about a way of thinking.
Yeah, you know, we've been trained by the whole medical establishment that you go to the doctor, you take a pill, and that's your total involvement, is to try to remember to take your pill every day.
Which, if you have an infection, it works great. Yeah, if you need to be on an antibiotic.
And if your interest is getting rid of the symptom, it works great, right? If you've got arthritis and you take a biologic, you're going to feel better.
Right, but over time, you may have side effects to taking that medication, and then it leads you to kind of, okay, now what do I do? Because I can no longer take this medication, or because of this medication, I have some side effects that I'm dealing with that maybe are even worse than the initial illness that you were dealing with.
A patient, as an example, with inflammatory bowel disease, had been sick for many years, was right up against, had already had the surgical consult, was right up against getting a part of his large intestine removed. Right? He's on 4 meds total, 3 meds, 3 conventional meds, and what's called a biologic. The biologics are the things you see on TV, you know, because they're costed $1 zillion a gram, and so it's profitable to put advertisements on TV. So he's on this big regimen and feeling miserable, right? Having multiple stools per day, lots of bloating and cramping and discomfort. And as I said, right up against having surgery. He has been approved for surgery. He's got a surgical date. He comes in for functional medicine. It took some time, but he was willing to stick it out. So within 3 months, he's off of all 4 medicines, feels better than he's felt in years. He's gaining weight. That's the other thing. People with inflammatory bowel disease typically have kind of a wasting disease because they're not really absorbing nutrients because everything's just going through. He's gaining weight. He's feeling good off of medicines, right? Because we were able to match his lifestyle, the totality of his lifestyle, to the totality of his exposome, right? The exposome is, if you can think of it, it's part of the exposome. So if it's toxins, if it's food, if it's pollen, if it's, you know, you name it, it's every single thing. And so when you make that match, you start to express genes that are anti-inflammatory, that are healing, that are whatever, instead of these aggressive, fighting, inflammatory kinds of genes, right? So that's just one example. I don't know, you have any patients that you remember from?
Yeah, I have one specifically. Well, and it could probably be repeated through multiple patients, probably dozens. But she just came in with a collection of symptoms that she had had for a long period of time. And, you know, over the past couple years, she had really just taken a dive to where she didn't even have the energy to do essential things in life, like prepare meals for her family or take her children to the park. But yet she had no real answers. She had seen different doctors and different specialists, and nobody could really pinpoint anything that was wrong with her. Everything looked great. All of her labs came back normal. And, once she came in, you listened to her, complete history, kind of what led up to where she was, and you were able to pinpoint and do testing and find out actually what was causing these issues. And it was Lyme disease. And then over the process of, the treatments and the supplementation and, doing those modifiable lifestyle factors, within, 9 months, she was a completely different person.
Yep, and that's just the repetitive story. Now, I'm not a magician. I was going to say musician. I'm not that either. But I'm not a magician, right? We have failures too, unfortunately. But you're really good at never giving up. So even if somebody comes in feeling, horrible 3 months later, you're always there to listen and then formulate a new plan with them. Yeah, but unfortunately, the truth is I don't get it right first try every time, right? So somebody comes in and, you all have experienced this, right? You come in, you tell the doctor I'm not any better, and they try to make it your fault that you're not better. No, it's not your fault. It's not really my fault. It's the disease's fault. And we have to figure out that match. And so it's not, well, I tried that and it didn't work, so now I'm done. Well, okay, but then what's the progress there? We have to try the next thing. So it goes back to the movie Frozen. Take the next, what is it?
Do the next right thing.
Do the next right thing. That's right. Do the next right thing. And that's what we try to do. And it's complicated. It's biochemistry. It's
no one size fits all.
Right. It's
completely different.
Hyper personalized. So, as an example, I was seeing a woman, frankly, for years, and we had gotten her a certain way better, probably 50, 60, 70% better. She was actually thinking, I'm feeling pretty good. But when she'd describe her life, I'd say, well, if that was my life, I'd be I wouldn't like to have to take a nap twice a day and do all these things, but that was a huge improvement for her. And it turned out that a big piece of her issue was this sort of hyper-responsive limbic system, right? The limbic system is that switcher in your brain that takes in all the sensory information and your memory information and communicates with your autonomic nervous system. And she was basically hardcore locked in fight or flight. I mean, you'd walk in the door and just turning the door handle, she'd go, whoa, And so we put her through a program we call our limbic retraining system. And it was miraculous for her. Now, is the limbic retraining system the one thing you do for everybody? No. It was the thing that she needed. And if you have chronic complex disease, you have limbic upregulation, and it needs to be managed, but not everybody needs the full hardcore program. Some people can get away with just kind of self-soothing behaviors and reading or meditating or whatever, but some people are so locked in that they need a real formal, serious program. So anyway, we put her through this thing, and she went from surviving, from nearly not surviving to surviving well to really thriving. And, she was able to finish school and do her career and all those wonderful things. So did very, very well. And so those are the kinds of things that happen when you keep pinging the patient and figuring out what is it with you, right? What is it with you? So that's really the difference with functional medicine. Conventional medicine is, here's the diagnosis. Because of this diagnosis, here's the treatment. And functional medicine is, okay, that's the diagnosis, but why on earth would you have this diagnosis?
Yeah, and synergistically with, as you're following the conventional model of the treatment, too.
Yes, synergistically, not instead of, not better than, different from, and synergistically with. Absolutely. Not putting down at all my great colleagues in conventional medicine. So, how does this process work for an individual? We sort of began to talk about it a little bit. We put together this timeline, and the timeline starts before your birth. And then once we have the timeline, we break pieces out into parts. So, we look at how is the assimilation function, how are you digesting and absorbing and all that business. And then we look at your immune function, and then we look at your energy production function, and then we look at your detoxification function, and then we look at your communication function and your transport function. And then we actually look at psychosocial, spiritual, mental, emotional, spiritual kinds of domains. We look at your modifiable lifestyle factors, and from all of that, we're pulling out these antecedents, these pre-existing factors. So I already talked about your, mother and father and uncles and all that stuff had inflammatory disease. So we're thinking about that. We're thinking about what are the, the antecedents, the triggers. What were the triggering events? That's when that timeline broke off, right?
Yeah.
And then what are the mediators? What's perpetuating your illness? And frequently it's all biochemical until we get to what's perpetuating, and that's often in that mental, emotional, spiritual domain, the limbic. Yeah. So, it's a process. And everybody wants me to say, well, take this supplement. Okay, well, you can take it, but and it's nice. It probably will help you, but it's not going to fix the problem. It's just green pharmacy. You can either have pharmaceutical pharmacy or green pharmacy and something completely different, functional medicine, right? So that's the process of how we treat serious sick people with serious medicine. And unlike going to the primary doctor, the regular whole conventional doctor who comes in, they're dedicated to wanting to help you, and they're going to help you by writing on a prescription pad and handing it to you, or sending it off electronically, and you're going to get a pill, right? Well, I call that passive care. We do active care, which means it's audience participation care. You have to follow through. You're going to change your diet. You're going to change your lifestyle. You're going to take supplements. You're going to do something, right? It's harder. It is harder, but it leads to a better match, which leads to higher wellness, which means that disease can't flourish. And rather than taking $1,000 worth of drugs every month, you might be taking, $100 worth of supplements. Unfortunately, your insurance covers the drug, so it feels cheaper, but it doesn't. But the stuff we're doing doesn't have the side effects and so on. So that's really the process. Now, that's the process for how we do functional medicine. Love to entertain your questions about it, but the real answer to any question unfortunately depends. We have to take your case, right? We have to take your case. We have to make a timeline. We have to make a matrix. We have to talk to you. We have to try it on. A very famous functional medicine doctor by the name of Sid Baker said that functional medicine is like tailoring a suit. You try it on. It's unlikely to be fit perfect the first time, so you're going to tailor it. And you're going to try it on again. You're going to tailor it again. You're going to try it on again. And we do these little tweaks. And again, excuse me, each one of these tweaks, I call it a ping. We're going to ping you and then see how you respond. And we do that at Just Be Well. So justbewell.info is our clinic. If you want more help, come talk to us there.
Yeah, or resources. There's different resources as well.
Yep, we have a lot of resources on the webpage. All right, well, we've been on about 30 minutes. We don't want to keep you all day. And it doesn't look like there's any questions. I kept talking for a while after calling for questions. And hello, Jane, and hello, Jackie. Great to see you guys. 10 a.m. is kind of a tough time, but it was the right time for us. So thank you guys for showing up. All right, so you have any parting words?
No, I have no parting wisdom. I should think of parting wisdom before.
No. All right, so we will see you next Thursday at 10 a.m. And, of course, these will be live both here, or not live, but they'll be They'll be here they'll be on YouTube, and they'll be on Facebook. And Brenda, is that? I can't quite read. Yeah,
Yes,
Brenda.
Brenda.
Oh, and by the way, next
for
week
watching,
we're going to
Brenda.
talk more about how to get that last 10% or last 20 or 30%, like that patient I just talked about who got 60, 70% better, and then how do you get that last bit after sort of the disease is gone, but your vitality never really returns. That's what we're going to talk about next week. So we'll see you at 10 a.m. Central Time, Thursday. Have a good week.
Oh, one more thing.
Oh, one more thing.
Oh.
You're very well. Oh, hey, Betsy. How's it going? Oh, that's somebody, a different Betsy. Sorry. I was going to ask you how it was at home, but you're in a different place,
how's it
I
at
assume.
home?
How is it at home? But it's not Tahoe, I assume. All righty. Bye-bye.
Bye.